Stephanie, and she's from the cardiac rehab area over at Riverside Medical Center, and she's going to talk to us about congestive heart failure. So thank you.
All right, good morning. Thanks for having me. Some of you recognize me.
Old friends.
Oh, yeah. So I want to talk to you about congestive heart failure. You may hear the term used, heart failure, congestive heart failure, CHF, HF. So we kind of use those terms intermittently, or exchanging them. So what I want to start with is an explanation of the heart. And if you were here last month, Marcy talked about the heart and healthy hearts and the chambers of the heart and the functions of the heart. And I just want to be able to explain that again so that heart failure makes sense to you. So can I do that? Okay. So if we look at the slides here, we talk about the human heart as being a shell. The shell is suspended in your chest in a pericardial sac by some tendons, okay? There are 4 cavities or open spaces in your heart, and obviously they fill with blood and they empty with blood. The top 2 are called the atria, and my next slide has a picture of this. The top 2 are called the atria, the bottom are the ventricles. And these guys beat in unison. There's a message sent from the top of the heart to get the upper chambers of the heart to beat. The message goes down to the bottom of the heart, and the bottom vessels of the heart beat in a healthy heart. The 2 atria, like I said, are on the top, and they make up the curved portion of the heart. The ventricles are on the bottom, and they make up that bottom, what we call the apex of the heart. The heart is slightly tilted in the chest and on the left side. So when nurses and doctors are listening to your heart, we're listening obviously on the left side. If you wanted to put your hand there, you could feel your heart beating on the left side. The left ventricle is actually the most important chamber of your heart. That's the ventricle that pushes all of the blood, or that's the chamber that pushes the blood from your heart to the rest of your body. So just remember that the left ventricle is the most important chamber. So here's a picture of the heart. And as you can see at the top, we've got the aorta. You've probably heard of the aorta. This is a curved structure with 3 openings. When your blood is traveling through your body, and it's been used, it's poorly oxygenated, you've used it for movement and for exercise and continuously, that blood is going to come from the lower portion of your body through the inferior vena cava back up to the heart. From the top of your heart, it comes back to the heart in the superior vena cava. And then they both meet in the right atrium. Now the atria contract and push the blood through this valve, the tricuspid valve, into your right ventricle. Looking at these valves, you can see that they're one-way valves. So when the ventricles contract, the blood could not or should not go back up that valve. And I'll talk about that in a little bit. Now when the ventricle contracts, the blood goes up to the pulmonary artery. So where does that blood go now? To the lungs. We're breathing, we're reoxygenating that blood. It's going to come back to the heart through our pulmonary veins into the left atrium. Again, the heart contracts, pushes that blood through the mitral valve into our left ventricle. Now this picture doesn't show it best, but this left ventricle is the largest chamber of your heart. It's the most muscular, because again, it has to squish to force that blood into your body. So the left ventricle contracts, it goes up through the aortic valve to the aorta at the top, where we've got 3 bifurcations, we call them, and now it's dispersed through your body. One goes up to your brain through your carotids, one is going to go down your aorta through your body, down your back, and the other one is going to cover like your arms and your legs. Okay? So remember, that left ventricle being the most important chamber of our heart. So the average adult heart is about the size of our fist, sitting right here. and it weighs about 11 ounces, so not even a pound. Our heart beats about 100,000 times per day, okay? And it pumps 5 to 6 quarts of blood, and that varies from person to person, which amounts to about 2,000 gallons of blood per day. And that's why I'm in this program, because I find the heart is just phenomenal. It keeps beating. No matter how abusive we are to our heart, it keeps beating and working for us. So, what is congestive heart failure? We describe it as the heart's pump getting weak. Our heart should beat 80 to 100 beats per minute, but sometimes as we age, or if we've had some type of heart problem, our heart muscle gets weak, and it's losing that pumping power. So the blood's moving through the heart at a slower rate. And as a result, the heart doesn't pump enough oxygen or nutrients to the rest of your body, so we start to feel sluggish, fatigued, tired, okay? And then in turn, the heart muscle walls eventually become weak, all right? And as a result, our kidneys respond, and they're trying to get rid of fluid, extra fluid. Now our kidneys cannot respond as quickly as the heart does. They're not responding like the heart increases its rate when it needs to. The filtration rate of our kidneys doesn't increase quite as rapidly like that. So what happens is fluid begins to build up. Most noticeably, the fluid will build up in our feet. So you might see at the end of your day when you're resting for the evening that you've got some swelling or some edema in your feet. You might be able to push on your foot or on your lower leg here and be able to make an indentation in your feet. That means that perhaps throughout the day your heart was weak, and that blood and that extracellular fluid is kind of staying in your peripheral system instead of your circulatory system. So the blood is kind of, that fluid is kind of between the circulatory, like your vessels and your skin, and it gets trapped there. And that's why we can feel it. You can push on it, and you can feel that swelling, that sponginess almost, okay? So this is what a healthy heart looks like on your left-hand side. It's normal. Everything's proper size. A congested heart on my right side here, you can see that the chambers have enlarged. They're more mushy. They're not as firm as a healthy heart is. The heart is actually kind of squishy, and it's not nearly as effective as a healthy heart muscle would be. One thing we need to talk about to understand congestive heart failure is your ejection fraction. Now remember, I said the left ventricle is the most important, strongest chamber of your heart. So when we talk about ejection fraction, we're talking about how much blood is being pumped out of your left ventricle with each contraction. For somebody who's young and healthy, has no heart damage, the left ventricle ejection fraction, I'm getting ahead of myself, normal left ventricle ejection fraction is about 55 to 70%. So what that says is when that chamber fills, 55 to 70% of that blood will leave that chamber with every contraction. So 45 or more percent stays in that chamber. Why is that? Anybody know? We have to keep that chamber open. If we would completely empty that chamber, that ventricle, it would collapse. So we have to leave some blood in that chamber. So normal amount of blood to be left in the chamber is about 45% or less. When somebody has 65% ejection fraction, we still consider that normal. But now when we look, an ejection fraction of less than 40% is how we determine somebody has congestive heart failure. So what that means is only 40% of the blood is being ejected from that left ventricle. So 60% is staying in the heart. So imagine your body only being able to use 40% of the blood that's being provided. That means you're only getting 40% of the oxygen that you need, 40% of the nutrients that your body needs. So if you're low on oxygen, your body's going to be tired. You might not be as alert. You might not have the energy that you should have because, again, only 40% of that blood is being ejected. All right? An ejection fraction of less than 35% increases your risk of life-threatening irregular heartbeats that can cause sudden cardiac arrest. We're losing the function of our heart. Okay, I've got people in cardiac rehab right now that have about 15% ejection fraction. They're very slow, they're very tired, very fatigued. They can only walk for a few minutes and then they have to rest. Okay, it's very debilitating. But the heart is a muscle, just like your bicep and tricep. Through exercise, we can increase that ejection fraction. Okay? But we have to be able to get them through that fatigue and build, and it's very, very slowly on building that ejection fraction. But when you go to the doctor and they try to determine whether you have congestive heart failure or not, they're going to look at your ejection fraction. And how do we measure it? We can do an ultrasound of your heart, pain-free, right? We put a little gel on your chest here. We use our ultrasound. And the techs are looking at each one of your chambers, and they can actually measure how they're functioning and how much blood is being ejected out. We can do a cardiac catheterization. So we go in through one of your arteries here in your wrist or in your groin. We take a little camera up to your heart, and they look at each one of your chambers of your heart, the valves, to see how much blood is being ejected and how much is staying in the heart. They can also use an MRI, and if you know that's the big machine, kind of a donut, and they put you on a table, you have to lay real still, and they slide you in, and you can hear the machine going zzz, 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 taking all these pictures of the heart. And then finally, nuclear medicine scan. You may have heard it called a nuclear stress test. A normal stress test is when we walk you on the treadmill. And every 2 minutes, we increase the intensity until you tell us, I can't go anymore. A nuclear stress test is when you're lying on a table and we're giving you medicine in an IV that speeds up your heart to simulate exercise. And that way we can tell what the activity is of your heart. And then finally, a CT scan of your heart, kind of similar to the MRI. Most often what we see is the echocardiogram, the ultrasound. That probably would be the first test that they would do. If they need more answers, they would do something a little bit more invasive. Okay? Does ejection fraction make sense? So basically it's the amount of blood ejected from your left ventricle with each contraction. The little bit scary part about a low ejection fraction is that much blood staying in that chamber. Now, what happens to blood when it lays in one spot? Clots. Right. So if that blood isn't being ejected and moving all the time, it's just kind of sloshing around in our chamber like this, there's a high potential for a clot to form, a big clot. Okay? So sometimes when people have congestive heart failure, we have to put them on a blood thinner so that we don't have that clot form. Okay? One way of keeping those clots from forming too is through exercise, because the heart has to work a little bit harder, forcing the blood out through the body so it's constantly moving. So we're less likely to have a clot when somebody is exercising. It's when they sit down for a long period of time, take a trip, or they're sitting in the car, or just being very sedentary that they're more likely to develop that clot. So here's just a graph showing those ejection fractions. Again, we've got the normal, we've got below normal. Less than 40% is what we use to diagnose congestive heart failure. Less than 35% is when you're at risk for those irregular rhythms. and some of them can be very life-threatening because the heart can go into what we call ventricular fibrillation, where instead of the heart beating and contracting with every second, it fibrillates, or it just shakes. And when your heart shakes like this, there's no perfusion. Blood is not leaving the heart, it's staying in there, so that means all of your organs are being without oxygen, and that can be life-threatening. The only thing that could help that at that time would be shocking the heart. Okay? Your EF can go up and down, like I said, through exercise. We can increase that ejection fraction through medicines. Typically, you'll be started on a medicine very quickly, and then the doctors will want you to be exercising to increase that strength as well. What causes congestive heart failure? One of the more common would be coronary artery disease. So that's when your vessels become blocked with cholesterol. We call it atherosclerosis, okay? A disease of the arteries that supply blood and oxygen. If the arteries become blocked or narrowed, the heart has to work harder. And that's what increases the pressure, is when the heart has to pump through narrowed arteries. So I use the analogy when I'm teaching class back at work. If you have a nice clean garden hose and water's flowing through it just beautifully, after a few years it gets full of stuff and gunk, and it gets kind of firm. You know how garden hoses get firm after time, and the water doesn't flow through that as well. Pressure increases, and when you go to open up the nozzle, you kind of hear that whoosh, and you can kind of hear that pressure relieved. That's what happens in our vessels when they start to develop that atherosclerosis. They harden, the pressure increases, which causes, for some people, angina or chest pain. It will raise your blood pressure, raise your heart rate, because the heart is having to work harder, okay? So we really want to try to prevent that cholesterol buildup in our arteries.
Is that when you lose one of your blood vessels or something?
Do you mean like when it becomes blocked?
All I know is my brother-in-law said that he lost one of his blood vessels. If he would have got the doctor sooner, the doctor could have saved it.
The only thing I can think of is if it became so blocked that they weren't able to remove that cholesterol from in there, that it was, I've seen patients whose vessels are so blocked they can't even get the camera in there. So that's when they do a bypass surgery, and they take a vessel from somewhere else and they bypass that blockage.
Never did it.
No, I'm not real sure what the explanation to that is. Sorry. All right, what else causes congestive heart failure? A heart attack. What happens when your heart attacks? Blood flow, nutrients, oxygen is not getting to a portion of your heart. So we call that a heart attack. When that happens, for some people, that portion of the heart actually almost dies because of the lack of oxygen and nutrients. So that part of the heart isn't functioning. When you lose function of your heart, then we've got more problems that can in turn lead to congestive heart failure. We need all of our heart working for us in order to function 100%. So the heart attack damages the heart muscle, and in turn, we lose that function. Cardiomyopathy is an enlargement of the heart. And you can see by the picture here, in a normal heart, our chambers relax and fill and then contract and pump. When we have cardiomyopathy, the muscle fibers have stretched so much that a heart is enlarged. You may have heard somebody in your family or friend say, I have an enlarged heart. That's the layman's term for cardiomyopathy. Again, when that heart gets big and muscular, or loses its musculature, it's not functioning like it should. And a big heart doesn't necessarily mean a stronger heart. It just means that that heart has been working so hard over time to compensate for high blood pressure, high sodium, overweight, obesity, shortness of breath. It's been working so hard over time that it's gotten large, but it hasn't increased its function in any way. So they say we have an enlarged heart.
So if you take care of back to its normal size?
A little bit, a little bit. Depends on how severe that damage is and how far that damage has gone. But certainly we always encourage people, make sure they take their medicines, get their activity, you know, eliminate any bad habits that potentially are worsening that condition. We have seen people's functional capacities improve once they've eliminated all those bad habits and following their medicine regime, but it'll probably never get back to normal function. Yeah. We see this happen in patients that abuse alcohol and drugs also. One of the side effects of those medicines, one of the side effects of alcohol and drugs is the cardiomyopathy. Okay. Conditions that overwork the heart. We talked a little bit about, yeah, go ahead.
Can you, as me, if I would be having congestive heart failure, can I tell myself or just?
You can, and I'm going to talk about that in a few slides from now. Yep, you'll be able to notice. Yep. So conditions that overwork the heart, like high blood pressure. Again, when our heart has to pump blood at high pressures, that overworks the heart, and it causes an enlargement of the heart, but can also cause congestive heart failure. People that have valve disease. Now, when I showed you the heart, I showed you those 4 valves. Those are one-way valves. They should only be able to pump blood one way. Sometimes those valves get weak or damaged over time. I've seen patients, particularly patients that have had some type of cancer, they're coming back years later with valves that are very diseased or not functioning. So what happens is those valves are supposed to open up with contraction and then close, open and close. When they've got a diseased valve, it might open but not close completely, so when the bottom part of the heart contracts, blood can gush back up to the top part of the heart. You might hear that in your heart as a murmur. You might have heard your doctor say, oh, you have a murmur. And that's when blood is going the wrong way up into the wrong chamber of the heart. Again, with that, we worry about clots because now blood is entering a chamber that has just emptied. It's not supposed to be there, so that blood's going to stay there momentarily until it gets ejected out. We see a lot of valve replacements in cardiac rehab, lots of them. I can't even name how many I have now, but they need to be repaired so that the blood is not going back up into the wrong chamber at the wrong time. People that suffer from thyroid disease will sometimes have heart problems as well, and kidney disease. Kidneys are the other organ that regulate our blood pressure. Okay, so they're constantly monitoring and regulating our blood pressure to keep it at its normal level. If our kidneys start to fail us, we can have high blood pressure associated with that. People with diabetes, and then those born with heart defects. Symptoms of congestive heart failure. This is what we were talking about. So sudden weight gain. If you notice that in a matter of one day, you've gained 3 pounds. You weigh yourself, and I highly encourage you to be weighing yourself on a daily basis. It's good to know what you weigh. It's good to know what your blood pressure and your heart rate is, just so you know your body well. So if you notice that you've gained 3 pounds in 24 hours, or you've gained 5 pounds in a week, that would be an indication that perhaps you're going into congestive heart failure, or you're having what we call an exacerbation or worsening of symptoms of your congestive heart failure.
When you say in one day, then does that disappear in the next morning?
It might. It might. It can. We've seen people come to cardiac rehab. We haven't seen them since Friday. They come to cardiac rehab on Monday and they've gained 3 pounds. So we listen to their lungs to see if any of that fluid is backing up in their lungs. And we'll just make sure, we'll check their feet to make sure, we have an idea of how advanced this might be. But they might come back on Wednesday and the fluid's completely gone. And I'll talk about why that happens in a second here. So edema is another word for swelling. If you notice increased swelling in your feet, in your hands, some people will say, man, I wasn't able to get my rings off over the weekend. If I eat Chinese food, I won't be able to get my rings off. It's a lot of sodium. If you notice that your shortness of breath is worse, you can't get up and walk to the bathroom without having an abnormal amount of shortness of breath. Are you having a difficult time sleeping? People in congestive heart failure have a really tough time sleeping on their back. They feel almost like they're drowning, like this fluid is just smothering them, like they've got an elephant on their chest, they'll say. So they have to sleep with their head elevated or in a recliner. Do they have dizziness that they haven't had before? Okay. Have you noticed a decreased urine output? Do you normally urinate 6 times a day, and now you're only urinating 3 or 4? Is there less urine that you're putting out than you have, you know, the day before or several days before? Okay.
Did I understand you right? You don't sleep. I'm not done sleeping. You possibly get dizzy.
Get dizzy if you don't sleep well?
I'm the street to say something.
Those were 2 different symptoms of congestive heart failure. So people that are having congestive heart failure don't sleep well if they're laying on their back, but then during the day sometimes they feel dizzy because the heart is having to work hard. We're not getting a lot of blood up to our head because the blood is getting stuck down here in our feet. So the lack of sleep and the dizziness aren't necessarily playing together. It's 2 separate symptoms of congestive heart failure. Okay? Did that answer your question? Now you probably, if you have not been diagnosed with heart failure, you're probably not going to wake up one day and say, oh, I have swelling in my feet, I have congestive heart failure. That would need to be diagnosed by the doctor through multiple tests. And we're going to talk about something here about managing it that can also affect the amount of swelling in your feet also. How do we manage heart failure? Our doctors prescribe medicines for us. We want to make sure we're taking those medicines as prescribed, particularly your medicine that is meant to diurese you or to help you get rid of fluid. Is anybody familiar with furosemide or Lasix, spironolactone, thiazide, hydrochlorothiazide? Those are medicines that basically kind of give our kidneys a jump start to say, work a little harder, guys. We need to get rid of some fluid. And after you take that medicine, suddenly you're running to the bathroom more frequently because your body's trying to pull all of that extra fluid out of your body and excrete it out. Okay? Important to take that. I can't tell you how many patients I have come to cardiac rehab in the morning and their weight is up and we say, did you take your water pill this morning? Did you take your diuretic? No, because I didn't want to have to run to the bathroom while I was in cardiac rehab. Well, now your weight is up. Now I have to call the doctor. Now we have to do this. So I understand if you know that you need to go to the library or to Fleet Farm and you don't want to have to run to the bathroom, but make arrangements to make sure you're taking those medicines as they're prescribed. You might have to get up earlier in the morning to take your medicine so that you're all urinated out by the time you have to go to the doctor or do your errands. Same thing in the evening. If you're told to take that medicine twice a day, you don't want to be taking your water pill, your diuretic, at 7 o'clock at night. Because now you're going to be getting up, going to the bathroom at 10, 11, 12 o'clock at night. So take it around dinner time so that by 8 o'clock the medicine is worn off and you can sleep. Okay? Right, Bill? Okay. All right. Weigh yourself daily and write it down, especially if you're somebody that's been diagnosed with congestive heart failure. It's great to have a tablet at home with the date on it, your weight, your blood pressure, your heart rate. We really encourage you folks to take the initiative, manage your care, so when you come in to see the doctor or a nurse or us, we know that you are involved. You are taking the initiative to take control. But also it tells us, oh, you know, you've done a good job. We can see your weight's been stable, your blood pressure's been stable, everything looks good. Sometimes when you come to us, your heart rate is up, your blood pressure is up because it's an unusual department. You don't, you know, you had to get up to come to us. Maybe you're a little nervous about being there. You're scared about exercise, and so we're seeing higher heart rates and blood pressures. Well, we have a policy that we have to notify your doctor if your blood pressure is over 140 over 90 3 days in a row. So we encourage you to do your blood pressures at home so that we can compare those to say, oh, well, your blood pressures are great at home, they're not so good here. What we're going to do next is ask you to bring your blood pressure cuff in so that we can compare it to ours to make sure it's accurate. But then we also know that, you know, it's probably the environment. You're more comfortable at home and you're getting the more accurate blood pressures than you are with us. And we use those numbers. And the doctors will do that too. If you've got numbers at home and you bring that list of blood pressures to the office, he can see what you've had at home. Some people suffer from what we call white coat syndrome. When you get into the doctor's office and you see the doctor or the nurse, suddenly your heart rate increases, your blood pressure increases because you're nervous. Well, if we take your blood pressure now, it's going to be high. And we don't want to treat you for high blood pressure if you truly don't have it. So it's good to have those numbers at home. Okay? And your weight as well. Follow a low sodium diet. Everybody should follow a low sodium diet. If there's anything that's going to put someone into congestive heart failure, it's high sodium. I have seen so many people call me on Monday and say, can't make it, short of breath, my weight's up. What'd you do, Al? Well, I had pizza last night. Or we made brats and burgers on the grill, and now, you know, I don't feel good, my weight's up, my feet are swollen. Water follows sodium. They like to live together. So if I eat a lot of sodium, the water is going to stay in my body. The last thing we want in our body is extra fluid. What that does is it increases the work on the heart, because now the heart is pushing, instead of 5 to 6 quarts of blood, it's pushing 7 to 8 quarts of water and blood fluid, and that's a lot of work. That's what puts us into congestive heart failure. So we really have to limit our sodium intake to prevent congestive heart failure. How much sodium, does anybody know? Maximum of 2,000 milligrams. This is less than 1 teaspoon of salt from all sources. Okay? People will say, well, I don't use a salt shaker. That's great, but that's only a tiny % of the salt you actually consume. If you buy anything from the store that's packaged, canned, in the frozen section, it probably has sodium in it. If you buy something that says it's fat-free, what happens when we take out the fat of a food? Tastes awful. How do we get people to buy the food? We have to add flavor back, so they add salt. So don't be bestrewed by those packages that say fat-free. Turn it over, look at the sodium content. And if you're somebody that needs to watch sodium, you need to be looking at that. And if it says it has 1,700 milligrams of sodium in one package, that's almost your whole entire allowance for the day. So really, really, really be alert to what's out there.
Well, even those cans mark 1/3 less sodium. Still high sodium.
Right, because you don't know how much sodium was in to begin.
In other words, vegetables and so on, I buy no
Yep.
salt added.
Yep, exactly. Packaged foods are notorious. Macaroni and cheese, any of those noodle foods, anything that you have to reconstitute, like soup. The best thing you can do, folks, is try to make your food homemade and buy it in its most natural state. Fresh is best, because you have no idea how much sodium they're putting in those products. They don't care. They just want to sell the product.
Like you pour the juice out of flowers if they can, are you pouring the sodium away?
Say that again, please.
Drain, if you
Oh, you
drain
drain.
something
From fruit?
from like
Or
say
vegetables.
In a can, there's that juice there. And then you should throw that away. Are you throwing the sodium away?
Some of it, but you're probably you're probably throwing away a lot of the nutrients too, because the longer that vegetable or fruit sits in a can, those nutrients leach out into the fluid. Same thing with the salt that's in that can and all the preservatives. It's leaching into the vegetable when it sits in that can too. So really no. Ideally you'll buy frozen, and a lot of times frozen is cheaper. And then you can heat up as much as you want. So if you buy a package of frozen peas or beans or corn, you can just put as much as you want into a pan and heat it up or heat it up in the microwave, and then you've got your serving size instead of opening up a whole can.
That's what we're talking about. You got too much sodium in your body.
Right. Right. So if you buy frozen vegetables, there's generally no sodium added to those vegetables when they're flash frozen. So then you wouldn't get the sodium.
You should put sodium in then?
No. Nope. We want to try to eliminate the sodium as much as possible from our diet. Our body needs sodium. Our heart needs sodium and potassium to function. So it's not like we don't need sodium, but we get more than enough sodium just by going through our day. We don't need to ever add additional sodium. When I go to restaurants, I'm a people watcher, and my husband's like, stop looking at them. But I'm always seeing what they're doing. And, you know, they sit down to eat, and they haven't even tasted their food, and they're just loading the salt shaker. And kids these days, they're doing the same thing. I mean, I just get chest pain when I see that because they have no idea what's happening. And because when you acquire that taste for salt, you always want it. And it's hard to eliminate salt in your diet then when you're used to having it.
It's the other way too. If you're used to it without
Yes.
salt, you sure taste it right away.
You do, absolutely. So salt is an enemy for anybody with any type of heart problems. You really want to eliminate as much sodium from your diet as possible. If that's the one thing that you take from here today, that would be my highlight, is really look at your package ingredients, look at the table that lists all of the percentages of calories and milligrams of sodium and potassium. Really pay attention to that sodium. If you know that you should only have 2,000 milligrams of sodium per day, and that's on the high end. If we have somebody that comes into cardiac rehab with a history of congestive heart failure, they get 1,500 milligrams of sodium. So we're being pretty lenient offering 2,000. You really want to try to get it down to 1,500 if you can. There's a lot of options out there for sodium-free products. If you go to Pick and Save or anywhere, you can see them listed there. Penzeys and Appleton is fabulous. They've got enormous amounts of seasonings without sodium, and they're fabulous. Woodman's, yep, lots of options. And you don't go through them very often, I mean a lot. So you buy your bottle and it should last you quite some time. But it's an acquired taste. I've got a lot of young guys coming through rehab now that are in their 40s, and they like their salt. And so for them to slowly switch over is often very difficult. Okay, so try to avoid those processed foods, especially canned foods. Eat more fresh fruits and vegetables. Okay, fresh is best. Also review the nutritional information labels and packaged foods to decrease the amount of hidden salt. Monosodium glutamate, okay, things like that. If it says the word sodium in any fashion, you want to try to limit that, okay? Companies will hide those words in one way or another to try to fool you. All right, how do we manage heart failure? You want to get your regular exercise, okay? American Heart Association wants us to exercise about 150 minutes per week. So if we only exercise 5 days a week, that's 30 minutes a day. It doesn't have to be all at one time. If you can only exercise for 15 minutes, then do 15 minutes twice a day, 10 minutes 3 times a day, however you can to get that 30 minutes of exercise in. Okay? Start slowly, increase gradually, adding more time, more intensity. Monitor your symptoms daily. This is a patient with congestive heart failure. You can see her foot there. If you can push on her foot and that indentation stays, that's a pretty good indication that she's got some congestive heart failure. And we measure that in a 1+ to 4+. I've seen a lot of patients like that, and that indentation goes all the way up the leg. This foot needs to be elevated. When we're sitting like you folks are, we call that dependent position. It's harder for the heart to draw that fluid back up to the heart because it has to work against gravity and pull it up. If you have a history of congestive heart failure or you notice swelling in your feet, you want to get those legs to as close to the heart level as possible. So when you're sitting, legs elevated ideally, in a recliner, on another chair, whatever you can do to bring those legs up. So now the heart just has to pull it at more of an even level rather than from way down there. Okay? This person probably needs to be hospitalized, given some IV water medicines, diuretics, to help get rid of this fluid. Okay?
So if you've overindulged in salt, you're not supposed to drink fluids to try and flush it out because your heart can't pump it out. So you have to take, you're saying you get more diuretics? Or
That's what's going to get rid of the fluid. What's going to happen is when we take in sodium, we get thirsty, so then we tend to drink more fluid. If you're somebody that has a weak heart, that water's going to stay. So you're better off putting yourself on a water restriction for like 24 to 48 hours after you consume a lot of sodium so that there's less likelihood of that extra fluid to stay. You're probably still going to have some swelling because of all of the intracellular fluid and all of the water that's already in your system, but you're not going to go into a congestive heart failure exacerbation if you're not consuming all that extra fluid. When people are admitted to the hospital with congestive heart failure, we typically put them on a fluid restriction of maybe 1,500 cc's. So that's all they get to drink in 24 hours because we're really trying to prevent all that extra fluid from staying in our body. Plus, we're giving them the diuretic to get rid of whatever is there. So you're better off trying to stay away from the sodium so that doesn't become a battle. Statistics on congestive heart failure. There's nearly 5 million Americans who are currently living with congestive heart failure. That's a lot of people. But approximately 550,000 new cases are diagnosed every year. Okay? Congestive heart failure affects people of all ages, including children and young adults. Almost 1.4 million persons with congestive heart failure are under the age of 60, so it's not what we call an older person's disease. Heart failure is responsible for 11 million doctor visits every year and more hospitalizations than all cancers combined. Lots of congestive heart failure out there. CHF is the first listed diagnosis in 875,000 hospitalizations and the most common diagnosis in hospital patients aged 65 years and older. Here's one thing that hospitals are dealing with right now. If you are admitted with congestive heart failure and we discharge you, if you are readmitted, I'm not going to know the exact dates, if it's 72, how many days? I'm not sure exactly of the days. We don't get reimbursed for your next hospitalization. It is 30 days. I don't work the inpatient side. I just know that we're really trying to prevent these rehospitalizations. So it's a long time. So if we don't educate you on your way home before we discharge you and tell you how to prevent congestive heart failure and you come back in 30 days, we don't get paid. So hospitals all around the nation are trying to get the word out how to prevent the reoccurrence of congestive heart failure. Okay. Medicare just recently in January, or it was like November, just recently said that people with congestive heart failure with an ejection fraction of 35% or less can now attend cardiac rehab. So what happens is if I see a patient on the inpatient side that has congestive heart failure, I will go down there and I will start the education and we will get them scheduled to come to cardiac rehab. we will see them for 3 months in the hopes that we will prevent them from being hospitalized, okay? Even if Medicare has to pay for cardiac rehab, it's still way cheaper than one hospitalization. So that's something that all hospitals are dealing with right now. And it's not only for congestive heart failure, it's for other chronic diseases as well. So that's hurting us. All right, any questions? Anything that I've missed that you need to know? Anything about the heart that you need to know yet?
My mother has this, and she swears her doctor told her not to exercise or do anything. And I keep telling her that's not true. We've been having this argument for about a year now.
Yeah.
And, you know, I understand it's hard or exhausting, but, you know, and I say you just do a little bit each time. But there would be no doctor that would ever say that.
The only time a doctor would say that is if your congestive heart failure is so severe that we worry about your heart going into some type of arrhythmia with exercise. But if you have congestive heart failure and it's well managed, you need to be exercising. Even with those patients that I see as an inpatient, they cannot start exercising with me for 6 weeks after discharge. I start all of my education right away, and I see them every week for 6 weeks. Then they start to exercise. So after that hospitalization, the heart's really trying to recover, and the whole body's trying to recover. So that's the only time we would say no exercise. But again, if you're managed with medicine and doctor care, you need to be exercising.
All the education and really learned a lot. It was, I can't remember if it was here or in Arizona, but you know, she really came a long way with a lot of information and knowledge. And you know,
I think a lot of times we just think, we don't have to exercise. We're
that's
fine.
true.
Yep.
Yeah.
Is there any danger if you have low on blood?
Well, if you're low on blood, you're what we call anemic, which means your red blood cells carries your oxygen. So if you're low on blood, you're low on oxygen, so you're going to be tired, short of breath, fatigued.
I have about 3 or 4 points of blood in me, and
Yeah.
I got blood transfusion, but I never felt tired, and during that time I was going to have an operation. Doctor came over to me and he says, "You are very low on blood."
Yeah.
Then I had blood transfusion, and still didn't raise me very high. I don't know what I got right now, but I will be seeing my doctor shortly because I was going to have an operation and didn't go.
Yeah. Our bodies are pretty amazing. They develop this tolerance. So kind of like with alcoholics, they develop a tolerance for alcohol, and one person can drink 8 beers and be fine, and another person drinks 1 beer and they're not. Tolerance is what our body does. So if I had 4 quarts of blood, because I'm not used to it, I would be very short of breath. I'd want to sleep, I'd want to sit. But if you've lived with low blood levels for a long period of time, your heart and your lungs and your organs have developed what we call tolerance. They're learning to live with what your body's providing. Certainly, you know, we would want you to have more, and you might feel better if you had more, but if you haven't even noticed, you know, any symptoms, your body's probably just responding to say, this is what you're giving me, this is what I have to deal with.
I do a lot of exercising, and that's one reason why I really didn't notice it.
That could be because, again, your body's learning to live with it, and you haven't just become real sedentary with it. You're exercising and doing what you need to do, so you're not noticing it. What I told my pulmonary patients this morning, because we talked about exercise, is the more you do, the more you'll be able to do. Opposite of that, the less you do, the less you'll be able to do. So I encourage you to get up every day, you know, try to do some exercise right away in the morning, after lunch, after dinner, whenever you can fit it in, so that you continue to stay strong and healthy, keep everything flexible and strong, and you'll have better quality of life.
I'm doing about 4 miles a day.
That's wonderful. That's more than I do. Anybody else?
So if you have a valve that like maybe regurgitates back in,
Mm-hmm.
does exercise, can it help the valve or no?
No,
the
that's
way it
just a
was?
structural kind of thing. Yeah, that regurgitation with that weakened valve it has to be repaired or replaced. Exercise isn't going to help that.
So that gets worse maybe as you age?
It does, because everything kind of weakens in there, and because of its ineffectiveness, it just kind of gets sloppy. So the doctors will measure, like your murmur, they'll say it's a 1 or it's a 2 until it gets to a certain point where they say this needs to be taken care of. Mm-hmm. Yep. Yep, Bill.
I generally have 25 to 30% ejection rate.
Is there any way to improve that? I mean, can you?
Basically, the best ways are through medication, so that you're taking your medicines as prescribed, and exercise. Because exercise, remember, your heart is a muscle like all of our muscles, and through exercise we can increase the strength. But we can't get lackadaisical with our exercise. You kind of always have to be increasing your intensity. To build muscle, you have to increase your intensity continuously. So doing a little bit more, a little bit longer, a little bit more intense, so that you can increase that.
Got an internal defibrillator too, and that has never gone off yet.
That's good.
He's
That's
been
good.
doing really, really great, but
Yep.
we were so surprised when we went back and they did the echo and it
Hadn't changed?
And
Okay.
I did have one problem with one of the leads
Oh,
that came out of the atrial, dropped down into the ventricle.
wow.
And so this February I had to go through redoing that part of it.
Oh, goodness. Wow.
So
Well, that was,
normally that would happen within the first month, but
yeah.
it's been about 9 months after it
Oh, interesting.
dropped out.
Huh. Yeah, it's amazing what happens. We see strange things all the time. Just, we don't know how our body is going to respond, and
Over the
Just-
winter I've gotten a little more weak again, but last fall I know that one day I went up to Stevens Point, came home with about 40 bags of pea gravel and 10 bags of mulch, and
yeah.
within 45 minutes I had it unloaded.
Good for you. That's great. And it's about energy conservation too. You don't have to be in a hurry to do anything. Just take your time doing the activity so that you can do it. I've got patients who love to garden, and they have 2 chairs in their garden, one at each end of the garden. So they work their way here, they sit and rest, they work their way back, they sit and rest. Nobody's running marathons. There's no sense in being in a hurry. Yeah, pace yourself so that you're still able to do those things you enjoy. Okay?
When you say intensify, do you mean like walking further if you're walking, or?
Or increasing the speed at which you walk. If you don't want to walk further, then just increase your speed so that you're walking with a little bit more intensity. Mm-hmm. And then when you get tired, just slow down a little bit, and then when you feel better, then increase that intensity. When our cardiac rehab patients get to the point where they're reaching their goals, but we still have some time left, what we do is have them do intervals. So we have them speed up for a minute or 2, and then back down, and speed up, and back down. So we're kind of shocking that heart into a higher intensity, but they don't have the tolerance for 30 minutes at that intensity. So it's just little kind of jolts of that higher intensity. And that'll just make the heart work a little harder so that and eventually you'll tolerate that intensity for longer periods of time.
I've got another question. That edema that you were talking about, can you get that because you don't exercise enough?
People can get it, like my mom and I took a trip to Myrtle Beach a couple summers ago, and she had swelling in her feet because we were on the road for 24 hours. And so when she got home, she couldn't even put her shoes on. She took her shoes off while we were traveling. She couldn't get her shoes back on when we got home. And she doesn't have any heart disease. It's just that those feet were dangling there for that long. And the heart, you're not moving, so the heart's kind of at rest. And when the heart's at rest, it doesn't find any reason to be working hard, so then that fluid starts to stay down there. So the best thing is when you get home, get those feet elevated. And I tell people, if you're going to be sitting for 4 hours or more, you need to get them feet elevated. You know, find a place where you can put your feet on another chair at least. Get up and walk. Yep, every 2 hours. I wanted to get home. But yeah, ideally every 2 hours you should be stopping if you're on a long trip to walk around. Yep.
Some exercises or tightening of your muscles you could do while sitting?
What we tell people is like heel pumping. This is what I do with my patients every day. We sit on the edge of our chair and heel pumping. So your muscles are squeezing your vessels and it's helping push that blood back up to your heart. This is the best thing you can do if you're sitting, even in church or you're sitting in an auditorium or anything, be sitting here doing this pumping exercise. Knee raises like this, you know, you can do that just about anywhere. We have people doing leg raises. Have them do the alphabet, write the alphabet with your leg. Anything that just keeps these legs moving. Circles, yep, do circles. Anything to get that blood pumping. Okay.
What makes your feet tingle?
Well, sometimes it's because of neuropathy. Patients with diabetes lose feeling down there. Sometimes it's because blood flow is poor, and if you're not getting oxygen and nutrients down to the toes, they start to tingle. If you notice your feet turn gray or blue or purple, brown.
When I'm sitting, sometimes I can't hold my feet still at all.
And sometimes it can be restless leg syndrome too.
I got Parkinson's disease.
Yeah, and that could be related to the Parkinson's. When I worked in the nursing home, we had a gentleman that had restless leg, and he'd have to get up and walk the halls in the middle of the night just to help that restless leg just kind of quiet itself. Get up and move.
One more time.
That's good. That's good.
I don't get to bed before 8, but I'm up at all 3 or 4.
Oh, yeah? You're up with the birds. In the summer, it's great to be up that early. You get to see the sunrise.
I wish you were exercising at 6:30.
That's wonderful. That's what I like to hear. Yep. Anybody else? Well, thanks for coming in today. Thanks for being a good audience. We're in the 900 building on the campus. If you ever have a question, stop by. We've got about 7 nurses that work in there, and they love to educate, love to help you out.